Danforth.
Thank you, Speaker. My question to the Acting Premier. Mohammed Akbar is a 27-year-old Torontonian who is currently working on a 3-month contract. He has no health care benefits, no dental plan at all. His wisdom teeth are bothering him, and he knows they need to come out, but he can't afford to pay out of pocket for the procedure. Dental care is one of the basics. Why hasn't the Premier or her Liberal government done anything in their 15 years in power to help people like Mohammed?
Thank you. Acting Premier.
Speaker, thank the member for the question, and I want to say, Speaker, that our government recognizes that to ensure fairness and opportunity for all Ontarians, there is an important role for the government to play in supporting access to oral health care for vulnerable people. Speaker, that is why over the years we have been working hard to in strengthening the Healthy Smiles program, Speaker. Excellent. That program has been expanded. That provides preventative, routine, and emergency dental services for children and youth from low-income households across the province. In fact, Speaker, this program is helping more than 470,000 kids access important dental services, and this number continues to grow. Speaker, we started with children and youth as evidence suggests that oral health problems are more prevalent among low-income families and children being most vulnerable. But we know, Speaker, there's more to be done, and I look forward to addressing that in the supplementary.
Supplementary.
Thank you, Speaker. Again to the Acting Premier. Mohammed grew up in a low-income household. He started working young to help out his family and to save for school. When he was 18, he had an accident on a construction job. He broke one of his front teeth. Mohammed wasn't able to get his tooth repaired properly for 8 years. Why has the Premier left people like Mohammed to struggle in pain with no dental care for so long?
Thank you. Acting Premier.
Speaker, as we reaffirmed in the speech from the throne, our government will be making advancements to ensure that more people without a drug or dental benefits plan will have access to more affordable prescription drugs and dental care. Speaker, we recognize, and we have heard those stories from people like Mohammed as well, that it's important that they have access to prescription medication and that they have access to good dental care. And that is why we appreciate the ideas brought forward by the third party are looking at ways to make those type of programs available. That is why we've been working with the same advocates in our community to get ideas how best to do.
Thank you. Final supplementary.
Thank you, Speaker. Again, back to the Acting Premier. Mohammed says that he suffered terrible self-esteem problems as a result of his front tooth being damaged for so long. He says the NDP dental plan will mean a significant improvement in his health and well-being. The plan will ease his anxiety. Why has the Premier done nothing in her time in office to ensure that young people like Mohammed don't suffer lasting emotional and physical pain because they can't afford to go to a dentist?
Thank you.
Speaker, our government has been focused in strengthening and building our healthcare system, making sure that it is available to people, that it is a publicly funded system that is available universally across our province. And Speaker, that is why we have continued to invest in good primary healthcare so that more and more Ontarians have access to a family doctor or nurse practitioner or to their local community health centers to get good health care, Speaker. That is why, Speaker, just like as I was announced today, we're continuing to invest in our hospital, Speaker, so that there's good capacity and good care available through our hospitals. That is why, Speaker, we are expanding OHIP Plus program, a program the first of its kind in North America that is making sure that children and youth till the age of 25 have access to free medication, and it will expand to include our seniors 65 and above in age as well. These are important building blocks, Speaker. These are important investments to create a healthcare system that is truly universal in nature, and this government, under the leadership of our Premier, has been working hard at accomplishing that.
Good question.